So I welcome you all to the live streaming from AJINORAH Global Ventures. So it's regarding essential skills and qualities in OIT reading, part B, especially part B. So we'll wait for a few more minutes so that all others can join. So Arvind sir, hi. Fessy ma'am, hi. Good morning. Vipin sir, hi. Glory Fernandez, hi. Shine sir, hi. Adarsh, hi. Neetu ma'am, hi. Good morning, Neetu ma'am. So good morning all once again. Welcome Sharon. Welcome Sharon. Good morning, Binu sir. So once again, good morning to all from AJINORAH. So today we are going to deal with some kind of essential skills and qualities which are used to crack the OIT reading subtest. So we'll just wait. Ajo sir, hi. So before beginning, I will introduce myself. I am Alvin and I am OIT trainer here at AJINORAH Kochi. So before moving to the core part, I would like to inform you good news for nurses. So we have direct client interview at different places all around India. So AJINORAH Global Ventures in association with AJINORAH Overseas Consultancy is conducting a direct client interview in Mysore. So it will be conducted on 22nd October precisely by 9 AM. So freshers and experienced candidates can apply. So you can rush with your CV to dor@ajinorah.com. So other than this client interview in Mysore, we have at 4th of this 4th of next month, that is November, at Mangalore, and 5th at Bangalore, then followed by 12th, 13th and 19th of November at Chennai, then Sacred Heart Bangalore, and 19th at Calicut. So we also have a direct client interview on 30th of next month, 30th of this month, Delhi. So I think this is really a golden opportunity for nurses, especially for freshers and experience. So all of us can apply. So let's begin our live streaming. I know, everyone will be really curious to know the easiest methods and easiest tips to crack the OIT reading subtest. So we are here to help you out. So before that, let me ask you something. Do we need any kind of supernatural powers to crack the OIT reading? Definitely not, because we all are common people and we all can crack the OIT reading subtest easily. So that is what we are trying to get you into. I know all of you will be aware of the tips and strategies that we usually use to do reading. So apart from that, what I am trying to point out is regarding some essential qualities or essential skills that we must possess. Essential skills, as you see, essential skills and qualities that we must possess while doing OIT reading. So these kind of essential skills and qualities that we have to develop our own, because this tips and strategies, what is the difference between skills and qualities with different tips and strategies? So coming to that point, the tips and strategies are quite scientific, and it's quite scientific, we can follow that. But regarding the skills and qualities that we have to develop, the skills and qualities we should develop those. So we have to develop these skills and qualities by regular practice and another ways of practicing, either at home or at the institution. So we will begin, or we will move to the topic. So I will just point out a few qualities regarding the OIT reading. So I'm trying to get you into 5 main qualities that we should possess. So after that, we will discuss each quality in detail. So the first and the foremost quality while doing reading is to be sensible. So we have to be sensible while doing OIT reading. So everyone will be wondering, so what is this sensibility, how the sensibility comes into play while doing the reading. So we have to be sensible. So what we say is we should have a common sense while doing reading, because while we approach a question, I know everyone will be tensed, especially in an exam point of view, we all will be tensed, but try to be cool at the time of approaching the question, because it has a really big roots in our reading subtest, especially in reading. All the subtests have its roots, but especially in reading, because sensibility plays a big role. So when we approach a question, we have to be very sensible. We have to read the question, we have to understand the question, we have to understand the options, and finally we have to understand the text of that particular question. So coming to that first point, be sensible. So if you look at a question, we will show you a question. So this is a model question. According to the passage, apheresis is currently being used often in. So we can see how we can apply the point sensibility in this particular question. Okay, so first of all, we should read the question maybe twice or thrice according to your ability. So I'm reading it once more. According to the passage, apheresis is currently being used often in. So there are some points that we should stress out, like apheresis, certainly, yes, this passage will be related to apheresis, and it's currently being used in. So coming to the question, each question demands us something to find out. We have to find out something. That question demands us to find out something from that particular paragraph or particular text. So we have to find out the aim of that question, and we have to search for the answers according to that. So I hope it's clear with everyone. So we will just read the options of this question. So option A, curing cancer; option B, treating animals; and option C, extracting plasma. So these are the three options for this question. So we know that the text is related to apheresis. So apheresis is an extracorporeal therapy in which blood is removed from patient circulation and the blood is separated into its components, and one or more of the components are processed before blood is returned to the patient. Okay, so of commonly in veterinary patients. So after the passages, we can see that it's commonly used in veterinary patients. So this is a kind of paraphrasing also. So we have options whether it's using for curing cancer or treating the animals, or whether extracting the plasma. So in this part of the question, we have to be sensible about the question, about the aim of the question, and about the topic what we are dealing with. So here we are dealing with apheresis. So while we are searching for the answer, we should be very sensible, because we have to find out the answer. We don't have to read the whole text twice or thrice. We have to find the key point or the key sentence on that particular paragraph or particular text, then work on it. So that is what we have to do while doing the OIT reading, especially part B, because there's now kind of point, because we know that time management is really important in OIT reading. So there's no point in reading this whole text twice or thrice. So I think I hope you are getting my point. So what we have to do in this condition is we have to identify the key sentence as soon as possible, and we have to work on it, because our answer will be from that key sentence almost above 90%. Okay, so here the key sentence is: of the extracorporeal therapies, the apheresis is the newest form being used more commonly in veterinary patients. So we have to be sensible. Again, coming back to my point, we have to be sensible about the question. So what was the question? So can you how many of you can say what was the question without without looking to the question yet again? So that is what the point comes into play. We have to be careful about the question all around. So how many of you have faced with, I will just share an instance. So how many of you faced with such a situation where you are working on the options and the text for a long time, and still you couldn't find the answer? So if you face with such a situation, just look up to the question once again, because by that time, while the time we are working on the options and the text, we might forget the question. So if you face with such a situation, just currently look up to the question. So here the question is why, or currently for what apheresis is being used on. So we have find out that sentence, but yet we have not find out the answer. So we have find out the sentence, then we have to work on it with in relation to the options which are provided. So of the extracorporeal therapies, apheresis is the newest form being used more commonly in veterinary patients. So veterinary patients, so it is used more commonly in veterinary patients. So is that veterinary something related to animals, right? So I think we are aware of that particular word veterinary, because we have heard about veterinary hospitals, veterinary surgeons, everything which is related to animals or treating animals. So just see whether we have an option like that in our three options. Yes, we have option B, treating animals. So still I'm not saying that is the answer. Still we are working on the particular question. So for the sake, we'll just read the following tests. So therapeutic plasmapheresis or therapeutic plasma exchanger. So what kind of treatment or its uses, or total plasma exchange, so something about its procedure or something like that. So for us, from the question point of view, it's kind of irrelevant information. So this is how we must be sensible while doing the OIT reading. So we must be sensible about the question, we might be sensible about the options, and we might be sensible regarding the text which we are reading. So we must have an orientation. This also comes into play with while we are doing part A also. So while we are doing part A, we must be really sensible with all the 4 texts that we have just read, because while we are working on those questions, there's no point in turning down the pages turning down the previous pages and to find out the answers. So we might be really conscious. We must be conscious. That is the point where I'm trying to stress. We might be conscious and we might be really sensible. We should be really sensible while working on such kind of questions, especially part B. So I hope the point sensibility or to be sensible is clear with everyone. So we'll move to the next point, orientation. So all this comes under the key point sensibility, right? So what about orientation? Okay, I will explain. Orientation means while we are reading a question or reading a paragraph or a text, we must be aware regarding all the information or about what the paragraph is all about. So with the paragraph might be it will be a bigger or a large paragraph, but our answer will be in a small sentence which is cornered to the bottom or from the beginning. So we must be oriented. So still I am stressing on the point that there's no use of reading that particular text twice or thrice. Maximum 2 times, yes, we can read that particular text maximum 2 times, because our answer will be, for such questions, our answer will be indirectly in a particular sentence. But for an exception, there are kind of questions in which we have to read the text maybe twice, maximum up to times. For example, questions like what the author tries to point out or what is the general objective of the paragraph. For such questions, we have to read the paragraph twice or thrice. But at that time, while working on such a question, we have to be oriented about the whole text, because we don't have much time to waste. So I am trying to say, utilize your time wisely, because we don't have much time to waste. So we have to utilize the time wisely by working on the options and the text. So while working on the options and the text, we might be really thinking about the answer. We are searching for the answer, but at that time we must think about the question also. So we will again see with that same question how orientation can be made applicable at this question. So again, while we are reading about this apheresis, so it's an from the medical journal. So apheresis, which is an extracorporeal therapy, then its blood is separated into its components and one or more of the components is removed or processed before the blood is returned to the patient. Yes, I am really reading on all this regarding apheresis, but I just forgot about the question. I am searching for the answer. Curing cancer, treating animals, extracting plasma. So I am searching for that for many time, but what was the question? I just forgot the question. So look up to the question. We have to be oriented, because while looking up to the question twice or thrice, we waste seconds. Even seconds have a precious time while doing OIT reading. Everyone know that. So avoid trying to do the same things repeatedly. Avoid trying to do the same things repeatedly, because it consumes time. Everyone knows that it consumes time. If you do a same thing repeatedly, there's no point in it and it consumes time. So try to be oriented to that particular point. We have to be oriented to that particular point, because I'm stressing on this point, because sensibility, then be oriented, it's all the kind of qualities that we should possess and we should improve, because these qualities can be improved by our effort other than those. So it can be improved by our effort. So we have to be oriented while reading the test. So without being much be intense, we have to be cool, rather than I think everyone will be tensed, especially at the exam point of view. But understanding that, still we have to get up good sense of mind and good orientation. So this is what it comes orientation comes to play in this question. Not only in this question, in all the questions, especially in part B. So we have to be oriented. While I'm reading this paragraph, I'm really oriented about the question and what is the aim of the question. I have to find out that. So as I told earlier, each question demands us to find something. Each question has a point. So apheresis is currently being used in. So that is what we have to find in this question. Apheresis, for what apheresis is currently being used. So still I'm not stressing up to the answers. So it is also recommended, if you read the text, if you couldn't understand the text, it is also I strongly suggest you to read the text in your mother tongue also, because while understanding each and every sentences in our mother tongue, I think it may be useful for those who cannot understand easily. So while we are reading, for instance, while we are reading this sentence, yes, apheresis is extracorporeal therapy in which blood is removed from patient's circulation. So just think this particular text in your mother tongue. So how does that sound? Yes, it is really useful. So I'm saying this from the point of view that I have experienced. I have experienced all this while I am doing my OIT reading. So just try to understand this text in your mother tongue, which will be very beneficial. But while applying all these tips and strategies, that is what I just told earlier, we all are aware about the tips and strategies that we use in this reading, because understanding the modal verbs, understanding the synonyms, understanding the verb forms, then differences between the words, we all are aware about such tips, so where we have to search for the answer. But these tips must be applied on the basis of these qualities. So that is the difference between qualities and tips. So all these tips are applicable when we have these qualities. Sensibility, then we must be oriented to the question. So if these are the two sides of a coin, consider these qualities and strategies or tips are as the two sides of the coin, then this comes in relation to each other. Tips and strategies cannot be applied alone, or this qualities cannot be applied alone. They should come in relation to each other. So that is what we are trying to get you into. So we have to apply our qualities and our tips and strategies along with these questions. So while we apply like this, we will definitely get the answer. I swear we will definitely get the answer. And also there are many opinions or in the part C. Yes, part B is some questions are really tricky, I admit that, but there are many opinions that in B part only 3 questions are answerable and the other 3 questions are not answerable. So all these are kind of superstitions, what I call it as superstitions, because all these 6 questions are answerable in part B, because that is what again I am trying to say. I have experienced the same feelings that you may experience now. All these 6 questions in part B is answerable. So while coming to part C, while we are doing part C, yes, it depends, because especially while we are coming to the second extract of part C, we might feel tired or we'll be stressed. So the finding out the answers depends. But just think about answering the whole 6 questions in part B right. It's really good, because if you have answered around 18 to 20 questions right in part A, if you answer 6 questions right in part B, then we'll have just we have to make just 4 or 5 questions right in part C. So that is the point in making all these 6 questions right in part C. So part B. Then also there are many methods to find out the answer in part B. For example, by using an elimination method. So in case you are using an elimination method, we must have a rationale for everything. We must have a rationale for everything that we do. So if we are eliminating, so here if we are eliminating these options, curing cancer and extracting plasma, we must have a reason to justify our action. We must be able to justify that. So that is the advantage of part B. So after doing part B, we ourselves can make sure whether we have chosen the right answer or not. So that is the advantage of part B. We have to justify each and every action of ours. So I hope everyone is clear with the point orientation. Coming back to our point, we all must be oriented regarding the text, question and the options. Then we'll move to the third quality, vocabulary and synonyms. So I think some of you will be afraid by seeing this vocabulary and synonyms, even I was, because it's really terrifying, because this is what some things really we may get tensed while dealing with these synonyms and paraphrasing especially. So even I was tense while doing this. So this vocabulary and synonyms, we can develop, or we can improve this by developing a good reading habit. What is the importance of developing a good reading habit? So if you develop a good reading habit, like reading English newspapers, English dailies, then novels, etc., so we may find new words which we are not aware of, which we are not familiar with. So just note down that kind of words while we confront with. So and just try to know the meaning of that particular words. So that is the importance of vocabulary and synonyms, because just read English newspapers daily. So while reading English newspapers, we may confront with many kind of new words. So just try to understand the meaning of that particular words, and definitely our vocabulary will be improved. So that is why that is how we improve our vocabulary. So coming to the same question again, I'm working on the same question because to make you understand how all these qualities is applicable on one question. If you move to the other questions, you might get confused. So how to apply all these qualities. So that is why I am working on a single question. So I hope everyone is okay with that. So regarding the vocabulary, so apheresis is an extracorporeal therapy in which blood is removed from patient circulation, or the blood is separated into its components, and one or more of the components is removed or processed. So this is a kind of a complex sentence. This is not a simple sentence, we know that. So if we have to understand such sentences, we should have a good vocabulary. Then coming to this of the extracorporeal therapies, apheresis is the newest form being used more commonly in veterinary patients. So treating veterinary patients, veterinary and treating animals. Does that sound same? Yes, it is. So that is what synonyms also, synonyms and paraphrasing. We will deal with paraphrasing in the next point. So this is what these points come to action in case of a vocabulary. So we have to be aware regarding the veterinary. So if a person of an individual with poor vocabulary might not understand at a single time when we read this veterinary patient, so those people may search for answers repeatedly in the text, but unfortunately they couldn't find. So we have to improve our vocabulary only by developing our reading habit. So how should we improve the vocabulary? Only by developing the reading habit, because reading habit is the prime and the foremost thing that we should develop before doing OIT reading. So I'm also not a person who had a good reading habit, but after I developed a good reading habit, yes, it was easy for me to crack the OIT reading. So that is what the importance of names. So just if you hear a new word, not only from reading, or if you hear a new word from anywhere, just try to note it down and just search for its synonyms also. It is really useful, I think, because if you search for the synonyms, there are many kind of words for each single word. So just if you hear a new word, just note it down and just try to get its synonyms, which is really useful. So this is how we should improve our skill in vocabulary. So I hope this point, vocabulary and synonyms, is also clear with everyone. Then coming to the next point, paraphrasing. This is also a kind of point which everyone will be afraid of, paraphrasing. So especially in part B, paraphrasing has a big role, part B and part C also, because for part A, yes, we can search for the keywords in the text. So we can write that particular sentence or particular word as it is. But in part B and part C, we must understand the meaning of that particular sentence. So that again, paraphrasing comes into role by only developing our reading habits, because we should understand, or we must understand the meaning of that particular sentence. We must be able to differentiate all the words in that particular sentence. Like there are different words that has similar meanings, but similar sounds, but its meaning will be entirely different. Like yes, like same and similar, its meaning is different, but it sounds similar. Okay, then reduce, remove, so all those kind of words, they sounds same, but their meanings are entirely different. So we have to understand such kind of keywords and sentences while dealing with the question. So This question also has a kind of paraphrasing. The answer is also a kind of paraphrasing of the commonly used aphorism is the newest form being used mainly in veterinary patients. So those people who are not aware about these veterinary patients, which is veterinary patients are used to, or it is same as treating animals, it will be really difficult to them to find out the answer. So at that point, before that, I will again explain a few tips for those people who find it difficult in paraphrasing. So in this particular question, I'm saying in the case of this particular question, so in this particular question, okay, just consider I'm not aware about this veterinary patients, I'm not aware about the synonyms and paraphrasing. So what we have to do here, we can use the elimination method. So in such kind of instances, we can use the elimination method. We can eliminate options like curing cancer and extracting plasma. So in such conditions or questions, we can use the elimination method. Because why? Because I'm not aware about the paraphrasing or the synonyms. I'm not aware about I'm not aware about the veterinary patients is also known as treating animals. So that is why in this case we can use the elimination method. So as I told earlier, while using the elimination method, we must have a strong rationale and a strong reason to justify our action. We should have a strong reason to justify our action. So is that, then we can consider that option B, treating animals, is the right answer. So this is only a tip for those who find it difficult, but definitely we can improve the paraphrasing, understanding the paraphrasing sentences, and definitely we can improve the vocabulary and synonyms, our skill in vocabulary and synonyms, by improving the reading habit. That is the only way to improve this. Everyone is asking, how should I improve my vocabulary? How should I is there any easiest way to understand those paraphrasing sentences? So the only way is to improve your reading habits. So you might not notice you are improving, but certainly believe me, I swear you guys will really improve if you improve your reading habits. So try to read out the newspapers, novels, anything you get in English especially. So that is what we have to be stressed out. So I hope everyone is clear with this point, paraphrasing. So coming to the last point, presence of mind. So this is the most important point while we are dealing with OET reading, presence of mind. The whole four points that I just shared now comes under this. We should have a good presence of mind. This sensibility, orientation, vocabulary and synonyms, paraphrasing, all comes in this presence of mind. Because if we have a good presence of mind, everything will come to normal. That is what I am trying to point out. If we have a good presence of mind, we will be sensible, we will have a good orientation, we will have a good vocabulary and synonyms, and we will have a good paraphrasing. That is the point I am trying to convey. So just consider, we have these skills individually. I am sensible, I am oriented, I have a good vocabulary, and I am really aware about the synonyms. I will really understand the paraphrasing kind of sentences. So what should if I don't have a good presence of mind, what will we do if I don't have a good presence of mind? All these individual qualities cannot be applied to a particular question. So the most important, the primary and the foremost, again I'm trying to stress out, the most important quality that you should possess while doing OET reading is a presence of mind. This is equally applicable for all the three parts, part A, part B and part C. So try to be cool, try to have a good presence of mind, because I will just share an instance. I have seen many of the people just continuously reading all the in part A all the text repeatedly, because we know we have to be oriented about the four texts, what is its contents in this all the four texts. If the first text will be kind of introduction, then second text, if we are dealing with a disease condition, the second text will be related to the diagnostic procedures, the third text will be related to management, general management, and the fourth text will be related to the pharmacological management. So if the question is related to the pharmacological management, so what is the point in reading all the three texts again and again? So I have seen that students doing the same, or reading part A, text A, B and C, and searching for the answers. So that is what we have to be sensible at that time. We have to be oriented to the four text at that time, and we have just search for the answer. Prioritize. I'm not saying that the answer will be definitely in that paragraph. So just try to prioritize the test. Why should you why don't you prioritize the text according to the priority? Because just start reading from text D if such a question comes. Then if the answer is not in text D, then go to text C, because we know that this is related to management. So the management protocols are embedded in text C and text D. So if there is not the answer is not there in text D, then go to text C directly. Then if there is not in text C, someone will go to text A, B, C. So there's no point in that. Go to text C. So that is how we utilize our time effectively. So we should have a good, again coming back to our point, we should have a good presence of mind while doing this OIT reading, because as I told, it is only applicable, all these qualities are only applicable only if we have a good presence of mind. We have to be cool, we have to read the question, we have to understand the question, and we have to search for the answers. So I think it is more appreciated especially in part B to read the question, then read the options, and then read the text. So it is really appreciated to follow this method, because if you are aware about the options, in most of the cases the option will be short phrases. So if you are aware about the options, it will be really easy to find out the answer. But just don't rely on options only. Don't try to search for the options in the paragraph. If you try that, there will be paraphrasing sentences, there will be synonyms, etc. So then also we have to be oriented and we have to be sensible. So I think everyone is clear with how all these qualities are really important in these cases. So once again, going back to the qualities, we will see it once again. We have to be sensible, we have to be oriented, we should have a good vocabulary and synonyms. So once again, I would like to stress out, you can improve your vocabulary and synonyms by developing a reading habit. So this is really important, just keep in mind. Then paraphrasing, and the most important, presence of mind. Just try it out. So if when you are practicing at the institution or at your home, just try to be cool, because at the time of practice we can do anything. So just try to be cool and just try to find out the answer based on these all qualities, which will be really useful. So this is what all the qualities are all about. So now we will just try to sort out these answers, these qualities in other questions rather than this. So the answer of this question is option B, treating animals, because we have seen veterinary patients here. So we'll just see the other questions. So we'll just deal with this question. The main purpose of the extract is to. So this question is a type of question which there will not be a direct answer. There will not be the answer in a particular sentence. So for this question, we have to read the text fully. So the main purpose of the extract is to. So this is the heading. This is related to regenerative medicine. Okay, a branch of science working to find ways to regrow or replace damaged tissue and organs has taken a huge leap forward in recent years. Okay, a new technology called tissue nanotransfection embedded in a tiny chip can reprogram skin cells to repair organs and blood vessels. With certain kinds of DNA, one kind of cell can be converted into other types, and the non-invasive procedure involves placing a postage stamp-sized chip on the skin and sending a small electric current through it. The process delivers DNA vectors into the body in less than a second. So far, the research has focused only on animals growing blood vessels in an injured mouse leg in a week and generating the nerve cells that helped mice recover from strokes. So this is our text all about. So how many of you remember the question after reading such a big text? So the question was to identify the main purpose of the text. So we will see the options. to explain a recently developed process in treating vascular injuries, to highlight the significance of tissue nanotransfection in treating mice, to announce an innovation in the realm of regenerative medicine. So realm means a kind of universe or a particular area. So we'll just work with option A initially. We will work with option A, to explain a recently developed process in treating vascular injuries. Okay, this text is all about treating vascular injuries, we know, because we have found that working ways to regrow, replace damaged tissue and organs. So something same with like vascular injuries also. So coming to the point, our option says that to explain a recently developed process. So let me ask you, while reading this text, can we say that regenerative medicine or tissue nanotransfection is already developed? No, it's not developed. So there is a change. That is how vocabulary, paraphrasing and synonyms comes into play. Okay, just see the sentence: a branch of science working to find ways. It's the branch of science, or regenerative medicine is just working to find its ways to regrow. So they are working on a particular aspect, they are working on a particular topic. So this is not developed, or it's not established. So that is how we can eliminate option A, because it's just working to find it ways, or just trying to, it's not developed. So this is how we distinguish between the option and the sentences. Science being working to find ways, and in option was to explain a recently developed process. So we can eliminate option A. Then option B, to highlight the significance of tissue nanotransfection in treating mice. So we'll work on that. So yes, this is, first of all, this paragraph, even if it is regarding the regenerative medicine, it is regarding the tissue nanotransfection, Okay, so while coming to the bottom or the corner, so we can identify, so far the research has focused only on animals growing blood vessels in an injured mouse leg in a week and generating nerve cells that helped mice recover from stroke. Yes, it is related to treating mice. Tissue nanotransfection is there, so it is used to highlight the significance of tissue nanotransfection in treating mice. So everyone will directly move. It's really I'm pretty much sure that the answer is to highlight the significance of tissue nanotransfection in treating mice. Okay, so before that, just wait before you confirm the answer. Just consider option C also, to announce an innovation in the realm of regenerative medicine. So before that, just come to option B, to highlight the significance of tissue nanotransfection in treating mice. Yes, the option is pretty right. Yes, the option is really right. Here in this, the nanotransfection is there is how we should imply nanotransfection in treating mice. But how many of you are aware about the question? The question was, the main purpose of the extract is to. Our question is not related to the main purpose of tissue nanotransfection or something related to that. The main purpose of the extract. So what is the extract about? The extract was about regenerative medicine. So we have to find, that is what we have to be oriented, we have to be sensible, and we have to be conscious about the question while we are working on the option and the answers. That is how we imply the qualities that we have previously discussed. We have to be sensible and we have to be conscious while working on options and answers. So many of you will directly select option B, but unfortunately it is wrong. So what will we do? We'll look for option C, to announce an innovation in the realm of regenerative medicine. Yes, because it is an innovation. Regenerative medicine or the tissue nanotransfection is an innovation in the sector of regenerative medicine. Regenerative medicine is already there, but tissue nanotransfection is an innovation. They have been working ways to regrow or replace damaged tissue organs. So it is a kind of innovation. So the answer is option C, to announce an innovation in the realm of regenerative medicine. So this is where all the primary qualities comes into play. If you are not sensible regarding the question, if you are not conscious regarding the question, we will definitely pick out the wrong answer, wrong option. So we have to improve all the skills. Coming to the next question, we will see one more question before concluding. So what does ethical code recommend to protect patients of an impaired physician? So just understand the question. It is regarding some ethical code of conduct. So what it recommends to protect the patients of an impaired physician. The question is how to protect the patients of an impaired physician. It is not related to how to protect an impaired physician or how to protect the patients of a normal physician. It is how to protect the patients of an impaired physician. So this is somewhat a kind of tricky question, because we'll just see the options. The physician of the impaired physician should not evaluate the impaired physician's progress. The physician of the impaired physician should not treat the impaired physician's patients. The physician of the impaired physician should monitor the impaired physician's fitness to work. So just reading the while we read the extract, so extract from the ethics manual impaired physician, then from the beginning every physician is responsible for protecting patients, so and so. Then coming to the bottom, this is where our answer is. To protect patients of the impaired physician, someone other than the physician of the impaired physician must monitor the impaired physician fitness to work. Okay. The whole three options are embedded in this particular sentence, in a single sentence. So we have to pick out the right sentence or the right option from this this text or this sentence. So we have to be sensible regarding the question. What was the question? What we should do, or what the ethical code of conduct recommend to do to protect the patients of an impaired physician. Okay, we'll see. We'll just read the sentence again. To protect the patients of an impaired physician, yes, the aim is correct. Someone other than the physician of the impaired physician must monitor the physician fitness to work. So, okay, someone other than the physician of the impaired physician, which means the impaired physician has no role in protecting the patients. So, someone other than, okay, just wait, come to the option A. The physician of the impaired physician should not evaluate the impaired physician's progress. So how many of you are able to relate the same here to the physician of the impaired physician should not evaluate the impaired physician's progress? So while reading, someone other than the impaired physician's physician, someone other than the physician of the impaired physician. So same meaning is here in option A, because the option physician of the impaired physician should not evaluate. The physician of the impaired physician should not evaluate his fitness or the progress of the physician. Who should evaluate? Someone. So we have to justify like this. Then if the physician of the impaired physician could not help or could not evaluate, then who could evaluate? A physician other than the physician of the impaired physician. So that is what the point comes from the question. Who should evaluate? The physician other than the physician of the impaired physician. That is same sentence. Just see, we are sensible, we are oriented about the question. The same sentence comes here. Someone other than the physician of the impaired physician. So the answer is really direct in this particular sentence. Many of you might get confused while reading all the three options. So the meaning is directly there in the sentence. So the answer is option A. The physician of the impaired physician should not evaluate the impaired physician's progress. So the answer is clear. So this is how we should apply all the skills. So this is only possible if we have a good presence of mind, because if we have a good presence of mind, we can think the same. If now I have a good presence of mind, so that is the reason why I was able to think like, so okay, the physician of the impaired physician is not allowed to monitor the progress. So then who should? There should be an answer. Then who should monitor the progress? So someone other than, so just read the sentence, someone other than the physician of the impaired physician. So the answer is direct. So the answer is same. So that is how we must imply all these qualities into our reading. So I hope it's clear. The skills and qualities is clear with everyone. Once again stressing, because it's really important and you yourselves can develop this. No one can train for that. You yourself must develop these. Be sensible, be oriented, must have a good vocabulary and synonyms, must be able to understand the paraphrasing sentences, and most important, should have a good presence of mind. So these are the main qualities that you should possess while doing IIT reading subtest, especially part B. So if you have any doubts on this, you can just post your comments in the comment box. It's all open for you. So we'll just wait for some more time. So if you have any kind of doubts, please kindly post it in the comment box. So if you have any kind of doubts regarding the qualities or even regarding the tips or strategies, definitely please feel free to comment down. So if you don't have any kind of doubts, I think we must conclude our live stream. So I think everything is clear with you all. So I thank all the technical team behind the camera. Thank you, Vipin sir. Thank you, Blasen. So thank you so much. Thank you, Jerry.